So I had a little convo with Mr. Myles McDougall about bringing private practice into our public healthcare system, and the amount of spin that I got made me dizzy. My name's Lindsay. I'm part of a small group of concerned citizens in Calgary Fish Creek riding who are petitioning to have Mr. McDougall recalled. Follow along if you want to stay informed and join our cause. So the first thing he told me was that dual practice will reduce public wait times. That sounds great until you realize that our problem isn't lack of facilities, it's lack of people. We do not have enough surgeons, enough anesthesiologists, and enough nurses to fully staff the facilities that we already have. So pulling these people away from the public sector, luring them into private where they're going to make more money, is only going to increase wait times, not decrease. The math here doesn't math. He could not produce any evidence from high-income countries that proved that dual practice reduces wait times. Actually, most countries are restricting dual practice because it has the opposite effect. It pulls people out of public. And the next statement is great. He says that doctors are flying all around the world from Alberta to do surgeries because they can't do them here. I know medical tourism is a thing and people will fly to get faster care or cheaper dental, but doctors flying other places and taking their patients with them? I could not find a single source that referenced anything even remotely close to that. So I don't know what kind of doctors Mr. McDougall's been chatting with, but I couldn't verify that statement at all. So the evidence that he did pull up for me are these two studies listed here. They are from low-income countries where the systems are not comparable. The workforce is different, the economics are different, the whole system is run differently. It's like saying we should look at Bolivia for our economics policies. Using incomparable systems to justify Alberta policy is not evidence. He also talked about safeguards, but so far, no safeguards exist. This legislation is being tabled now in the legislature, and they don't have any guidelines around it. How can you even vote on something when you don't know what the rules are? You'd think this whole recall thing would have taught them something. If you want specifics in your legislation, you have to write it in. Otherwise, things get weaponized. Then he got a bit uppity about the budget, and 40% of our budget goes to healthcare. That's totally in line with the rest of the country and a lot of other developed countries as well. Don't take a regular public expense and try and turn it into a crisis. The developed countries that he did use as an example, Norway, the UK, Ireland, either spend more per capita than we do or are actively trying to dismantle privatization in the public sector because it doesn't work. Ireland has been trying to do this for years because it proved inequitable and increased wait times for the public sector. Then he gets into the other countries do it argument, but none of these countries have evidence of decreased wait times due to privatization. Several of them strictly limit it, and a couple are actively removing it. Using this as a reason to bring in dual practice is like saying other countries have kids in coal mines, so we need to do that here too. Right? Just because other people do it doesn't make it a good idea. And lastly, he implied that privatization improves access. Well, I think we can all look at the government's most recent attempts to privatize Dynalife Labs and see how well that went. It increased wait times so severely that AHS had to buy it back. It cost taxpayers over $100 million. So here's what his answers actually told me. There's no evidence that dual practice will reduce wait times. There's absolutely no evidence that doctors are flying around the world to try and do surgeries. There are no safeguards in place currently to protect the public system at all. And considering that this is supposed to be put into effect in the spring of 2026, there's not a lot of time. There are no comparable high-income examples that show success the way this government is spinning it. The closest match, which would probably be Ireland, is actually repealing privatization because of the detrimental effects that it had on their healthcare system. Okay. Our own privatization attempt failed miserably, and we don't seem to have learned anything here. Okay. And the real problem is not space, it's staff. So until all of those extra seats that they opened up come to fruition, and those people are actually doctors and nurses and working in Alberta, they don't mean anything. And we are still in a staffing crisis for healthcare. So all privatization is going to do is increase the wait times for the public sector, and people are likely to die in these wait lists. But wait, the government stops tracking who died on wait lists. How convenient. We'll never know.